I'm Donna May Kimmaliardjuk. I'd just like to thank the Walrus and all of you for being here tonight and for thinking I have something of value to say about city planning, because I must admit, when I received the invitation to speak tonight, I felt a bit surprised. I thought, what do I, as a doctor, know about city planning? Not a lot. But then I realized healthcare, that's a huge component of city planning. And so tonight, my speech might take a slightly different angle than my co-speakers tonight, but what I hope to leave you with in these 7 minutes is this thought when it comes to city planning in the urban Indigenous population. Let's focus on what we do know and address that. And let's also figure out what we don't know and then address that. So why should Canadian cities care about the urban Indigenous population? Well, it's a population that's growing, and it's growing quickly. In 2006, according to Canadian census data, the urban Indigenous population was just over 620,000. In 2016, that number grew to over 867,000, up nearly 60% in 10 years. Urban Indigenous people comprise over half of the total Aboriginal population in Canada, and it is the fastest growing segment in Canadian society. I don't think I'm alone in saying this tonight, in that I don't think cities are doing enough to incorporate and reflect the cultures and values of the urban Indigenous people. And healthcare and health services are definitely not immune to this. Urban Indigenous people are more likely to face barriers in accessing health services due to discriminatory policies and practices. For example, jurisdiction in and of itself is a significant barrier to health services provision. Often bureaucracy has led to inequalities in access to health services to urban Indigenous people compared to Indigenous folks living on reserve. The type of healthcare that's available is also a barrier. Access to traditional healing practices is as, if not more important than access to mainstream healthcare for majorities of urban Indigenous people. Additionally, many health services and health programs are charitable, which is great, but evidence that there is currently inadequate funding of health services for the urban Indigenous population, and relying too heavily on these nonprofit funding structures can lead to services being unevenly distributed and unstable. So putting this together, I don't think it's a surprise for those of you in attendance tonight that Indigenous people living in urban areas are at greater risk of poor health outcomes. So what can I and others as healthcare providers do? I mean, I'm just one person, I'm just some doctor. Where do we start? How do we even make a positive impact when well-being is such a multifactorial entity? Well, I think the biggest area that you can make a positive impact as a single individual frontline is just ensure that you are delivering culturally appropriate care. I mean, what good is our care if what we're saying to our patients they don't understand? Or if they feel so uncomfortable with us because it is clear that we do not have an understanding of their culture and their values. Hospitals, medical schools, nursing schools, physio schools, pharmacy schools, all types of schools should collaborate and partner up with Indigenous organizations and government to develop and implement cultural safety training programs. Let's ensure that there are centers providing traditional healing practices in our cities and that healthcare providers actually know to reference them. When we look at the urban Indigenous population, the goal of providing healthcare and health services should be to provide adequate, accessible, and safe healthcare. So now how about at the government and policy level? How do we improve the healthcare outcomes of the urban Indigenous population at that level? Well, I truly do believe that using a social determinants of health framework is applicable and effective in trying to understand and improve the health of this population. But again, where can we start? I mean, trying to address social determinants of health is complex, timely, and an expensive endeavor. Well, what the thought I'd like to leave you with tonight is let's start with what we do know. And what we do know is that the majority of the urban Indigenous population is made up of women and young people, people under 30 years of age or younger. And so health services should prioritize care to these populations. For example, individuals who have higher levels of education, higher incomes, and secure housing tend to have better health. Yet high school completion rates and post-secondary completion rates amongst Indigenous Canadians continues to be lower than that of non-Indigenous Canadians. Communities that can work with Indigenous organizations and government to create ways to increase high school success rates and implement employment programming and opportunities can greatly improve the well-being of urban Indigenous peoples. Also, let's understand that some women come to urban settings to escape violent, abusive relationships, and there are many lone parent families. Thus, services addressing family violence, childcare, and urban transition, including income support and safe, affordable housing, are critical in helping to address the overall well-being of urban Indigenous women and children. And lastly, what about what we don't know? Well, there's a lot that we don't know. There's scarce, and I'm going to use this word, data, or scarce information on the urban Indigenous population. There's scarce information on health utilization. The Indigenous children population is rapidly growing, and yet we don't know a lot about them. There's also high mobility amongst urban Indigenous people within the urban setting and also between rural and on-reserve and urban locations. But yet the understanding of this and the connections with services is greatly lacking. So overall, there's a lack of long-term information on the socioeconomic status, urbanization, and health of Indigenous people living in an urban setting. So when addressing the health and well-being of the urban Indigenous population, we must consider the social, political, economic, and cultural experiences and inequalities of urban Indigenous peoples. And let's ensure that we're providing adequate, accessible, and safe health care. So again, let's focus our efforts on what we do know and address that. And let's figure out what we don't know and address that. And I truly believe that this will lead to healthier, thriving cities for all. So thank you so much.